Hi, and welcome to the preview of our Back Pain Secrets education product, which is our biggest video to date that we've put together, along with our um, extensive report with all the stuff that you're going to get. So I'm going to quickly go over this so you can see exactly what you're going to get with everything. So firstly, why do we make this video? Well, firstly, as most of us would know, if you're watching this, you probably have back pain or have suffered with it before. Um, about 85% of the population, it's estimated, is going to have an extreme case at least once in their life, and many of those people will actually have repeated cases and end up in chronic pain. So the current solutions for this are usually medications, anti-inflammatory type medic things, massage, physical therapy, acupuncture, worst of all, surgery. None of these actually address the real reason you're in pain. They might take away some of the pain or the symptoms that you're suffering with, but they're not actually addressing the reason that you got it in the first place. Even the so-called best of the best Pilates and others various strength training programs also don't address the real reason, because they're sort of looking too much at muscles and trying to isolate areas and looking at the area in pain, when often it's not the area in pain that gave you the pain. There's probably more to do with how you're moving and various other things are the reasons why you're moving that way. So all of these things forget to assess each case on its own merit, and like I mentioned just now, teach your body how to move. So the lack of education about movement really is where your solution to the problem is going to be found. And we know that this works because we've done this for over 10 years now. And obviously we only could see so many people from where we are, and we created YouTube videos to help our clients at the time, and even some of our trainers, to understand how to educate movement. And as a result of that, with the internet being as it is, things sort of started to pop up from all over the world asking me questions. So we thought it would make sense to actually document what we do and help people from all over the globe with some of these things that we're using, because they're actually quite simple. It just takes a bit of time to put them in place. Um, so what makes the video so good? So basically, we try to, as I mentioned, there's no like one size fits all. You have to use a lot of tests, and basically I'm giving you the tests. There's some extra ones that we would use if we were with you, but to make it easy for anyone to follow, even if you have no understanding of exercise at all, you can follow this pretty. I've simplified it down like quite a complex method into a simple, easy step-by-step program. So there's a test for you to see where your flexibility and balances are, or even if you even have any at all. Stability. So what are the tests we would use, as well as you can for strength, and then um, it, from there, then when you get, like, we show you how to choose the right exercises based on the results of the test. All right, so then knowing where to start, explaining all of these exercises and movement patterns and things like that in great detail. We give you over 60 exercises. There's actually an appendix on this one that I hadn't done with other ones because there was so many more exercises to include. So at the back there's about 20 videos in addition to the one that we've already got. So there's 90 minutes of video on in this one. So because obviously it's a lot more in depth. The manual's about 85 pages, I think, from memory. Um, Again, with all the pictures and instructions, step-by-step explanation, 6-month progressive program, 100% money back guarantee. If you do everything we tell you to do and it doesn't work, we'll give you money back because we're that confident that it'll work for you. You just need to be patient and allow time. You just can't rush this program. It's the downside of it. It just doesn't, you can't do it quickly. You have to do it slowly for it to have the effect that you're looking for. All right, so if you follow what we tell you to do, you'll get good results. All right, so let's take a quick look at what you're going to get. I'm going to slip into the. All right, so okay, so let's have a look at the ebook first. All right, so front cover of the ebook, and you'll see these are all the contents that you're going to get in there. So it's breaking up into, bit of background education at the beginning, and then moving through explaining some of the stuff that we're going to talk about when we get into the actual nuts and bolts of the tests and that, which is, really what's in the video. All right, so so if I sort of go through to what you're going to see. So here's all the background information, and there's some good statistics there and giving you some understanding of what stability, mobility means, why posture is important, why you should not treat the symptoms and treat the cause, setting up, you're looking for things like how you set workstation set up, understanding the difference in muscles, what we call the success formula, which was something we borrowed from Paul Chek. I find this is very, very effective in dealing with all types of injury, but especially back pain. Why we sort of teach movement, why it's so much more effective. Using different types of strength exercises, even though it's the same area, like why you really want to progress from that to that. This is again where a lot of the Pilates programs fail, because they just stay here and they don't go to there. Functional movements, so like how you then start to build strength in tasks that you need for real life. Understanding core strength, what the slings are made of, then the 6-step process. This is when we start to take you into the actual assessments, and you'll see here's all the assessments that you'll use. Some are flexibility, some are sort of stability, and some are strength. All right, so then we basically tell you how to do it, what you're looking for, what you should feel, what's the purpose of it, how you do it. And in the video, like I said, it'll probably give you a little bit more. Once you've done the test, then you move into the stability stage. I'll explain a bit about what stability means, and then you can see here instructions for each one, how to do them all, how long you should hold it for, so sets, reps, time, all of those things are all covered. All right. So right at the back, after we've gone through all the nuts and bolts of the exercises, you can see there's a lot, and nutrition as well. We'll cover a bit of that. Exercise programs. So there's like phase 1 with flexibility and stability, then moving to stability and isolated strength, integrated strength. So we're giving all the exercises to follow, sets, reps, time, rest, everything. All right, so you have 6 programs back, in a step-by-step process. All right, so that's what the ebook looks like. The video, here's just one of them. So
some stretches to loosen the tight areas with Dylan. Now, it's always very important to do stretching first. There's a reason we do stretching and mobilising of tight muscles first, and that's because tight muscles inhibit weak and lazy muscles, all right? So even if you've got the right strength exercise for the weak, lazy muscles, it's likely to be done poorly and very ineffectively, because the tight muscles will try to take over the workload. They just can't help themselves and want to do more, and the lazy ones are quite happy to keep it that way, all right? So to shut down the tight muscles and get the lazy ones to do it, we must weaken them. We must weaken the nerve input from the brain coming into the muscle of trying to overdo all the work, and the only way to weaken it is by stretching it or massaging it, all right? So once we do this first, it then opens up a window of opportunity for us to follow up straight away with a strength exercise to get the lazy one, all right? Which is what we'll cover in a second. But first we need to identify which stretches to use based on what we've seen Dylan do, all right? So
there's an example of where I'm explaining this flexibility stage, and I'm using 2 examples here. So if I fast forward through to later in the video,
being overstretched that need to be strengthened, but we can't do them.
Who's the 2 trainers here, I'm using simulating 2 different types of back pain. So we're going to use completely different stretches to completely different exercises, even though they have the same symptoms. So depending on which sort of side of the coin you're on, you'll be able to follow this video quite well. So you can see why we needed a little bit of extra time with this. All right, so I'll play a bit of this so you can get an idea.
Till we weaken the tight ones first. So we know from her posture that from what we've seen in the tests that she's completed so far, that there's the areas that we're looking for are abdominals up the top here, and the hamstrings. We saw them already on the test, and we're also going to look through the glutes here, and anything that's hard to do means it needs to be done. All right, so Mel's going to do the abdominal stretch. So she's basically just going to get into a position there where she's trying to arch her back over the ball. She's not too bad, actually. Some people we will see will be flat as a tack. So if she sort of lifts up like a bit like a crunch, that'll be as good as they'll get, all right? That's quite often what we'll see. They just can't actually extend through the rib cage through here, all right? Now the next one she's going to do is what is called the Mackenzie stretch. Now, if you're someone who's had a disc bulge, this is very important exercise for you to use all the time, all right? I can't stress this enough. This is the one way to make the disc settle back down from just repetition, all right? So it's usually sitting in poor postures and hunching so much, and then you just bend over one too many times and bang. All right, so all she needs.
All right, so there's an example of like where Dylan was what we call extension related pain, Mel's what we call flexion related pain. Completely different types of back pain from two different causes. So then once we've established the cause, then we can establish the right program to correct it. All right, so that's sort of the whole point of these products and the program itself, to help you get an idea of, like, where to start, what to do, and then, yeah, if you follow what we tell you to do, everything will just fall into place, and you'll get great results. All right, so I hope you've been um, I hope this sort of helps you to explain what this program's all about. And if you want to get your copy, just go to our online shop here. This is the URL for that. It's only $49 for the video and the manual, or you can just get the manual for $9. So yeah, otherwise you can email through to us from our website address. And yeah, I hope this helps you out and you get rid of your back pain forever.